Hello, I'm Tina Evans, the Cross System Initiatives Manager for the Ohio Department of Developmental Disabilities. Governor DeWine and the General Assembly have made unprecedented investments in addressing the needs of youth involved with multiple systems and their families. As a result, there have been many cross-agency initiatives and projects created or enhanced to help improve the lives of children and their families. DODD has been a part of much of that work and continues to learn about the strengths and needs of our DD system. Thank you to the Superintendent Executive Committee for inviting us to attend their subcommittees and the many county boards and providers that took time to share what is working or what the barriers have been to supporting youth with behavioral health needs. We also appreciate learning from those involved in the planned respite projects over the past several years. I'm here today with Dr. Julie Gentili to discuss the release of a white paper on multi-system youth. Multi-system youth are children and adolescents with complex behavioral health needs that require coordinated services of multiple partners within the child-serving systems. Some youth have such intensive physical, emotional, and behavioral needs that a single agency is unable to support the youth adequately. This subset of youth with complex needs includes those for whom the serving agencies find the most difficult to adequately serve, those for whom parents are most likely to relinquish custody, and those most likely to utilize an inordinate number of local resources.
Multi-system youth are also the most likely to enter the juvenile justice or child protective services systems, the most likely to end up in out-of-home supported residential placements, and the most likely to seek emergency services and inpatient care. Gaps in services and supports, including uncoordinated services, may negatively affect the education, health, and employment of youths or lead to re-traumatization or criminal justice involvement. State and local agencies must take the lead in coordinating efforts rather than expecting families to identify and coordinate resources on their own. Support for these families will reduce the risk of harm and facilitate the families staying together. These services and supports must be grounded in evidence and must focus on maintaining family unity.
One way DODD supports multi-system youth and their families is through guidance and technical assistance to local teams and families, keeping the following values at the forefront. Children with or without disabilities belong with their parents and families. Children have the best outcomes when they live with their families and have consistent access to the supports and resources they need and deserve. Research shows that children do best when they live as part of a family unit with a trusted, committed parental figure. Therefore, when children cannot remain with their family, an alternative family setting should be selected, such as kinship or foster care. There are instances when youth and families need respite or crisis stabilization outside of the home. When this is necessary, it's important that the length of stay is short-term and the strategies used to stabilize the youth are taught to the family or caregiver to ensure a smooth transition and prevent recidivism.
When supporting a child, it is imperative to support the whole family. Services and supports for the child and family must be holistic, trauma-informed, and evidence-based. To achieve DOD's mission of supporting community participation, that support must begin with the family and the family's community. DODD has compiled a wealth of resources for families to support their youth. The resources include teams of experts, specialized services based in science, respite, and points of contact so families are linked with services. Please take the time to review the Multi-System Youth White Paper. You can find it on the DODD website, dodd.ohio.gov.